to go. Wonderful. So hello everyone. Welcome to today's Fireside Chat. And this happens to be Fireside Chat number 180 since we started hosting these in January 2006. Today's session is entitled Experiences in Building Capacity for Legal Services in Canada. This happens to be the second of three Fireside Chat series that we're doing in collaboration with the Ontario Network for the Prevention of Elder Abuse. That's our partner. And our two advisors today, we're very fortunate to have Laura Watts, who is the National Director of the Canadian Centre for Elder Law, and Judith Wall, who's the Executive Director of the Advocacy Centre for the Elderly. And our other presenter, or actually our partner in this, is Rayanne, who is our Regional Consultant with the Central East Zone in Ontario for the Ontario Network for the Prevention of Elder Abuse. So we'll go to the third slide. And today's chat is we're going to actually just take a look at some examples of programs and policies, legal services, and programs actually for legal services for older adults in Canada. And we've got several presenters showing you some different perspectives on that. And with that, what I'm going to do is hand this over to Rianne from ONPEA, and she's going to introduce ONPEA a little bit and tell a bit why we're doing this series.
Great, thanks, Dot. I would just like to thank everybody for participating on this, the second Fireside Chat that we're hosting. This is an outcome of the National Elder Abuse Conference that we had back in November in Toronto. And for those who participated in the final wrap-up session, we asked individuals about how they, what they foresee as important topics to address, or how they would like to allocate resources or funds in the future to address the needs in elder abuse area. And of the top three issues that came up were the delivery of frontline services. The second was around legal issues and legal clinics for older adults, and the third one was around public education awareness. And within the legal scope that people were identifying as the need for allocation of resources was legal clinics, the programs and services that are out there for older adults, and that there is a lack of them significantly, as well as policing issues, those around police training and what programs and models that are out there. So we were fortunate to have funding from HRSDC when we were putting together the program for the conference to integrate three fireside chats into the after the conference. So as Dot indicated, this is the second of the series, and we're very fortunate, as Dot indicated, to have Laura and Judith with us, because they both have great expertise in this area. So we've asked them to share their experiences within this field. And then we also have a final wrap-up session with the policing models, which will take place next week on the 23rd, which you probably have lots of emails about. So we're looking at different policing models. So I'm pleased that everyone's joined us, and as we indicated, this is being taped so we can have it accessible for people who want to look at it or listen to it later as well. So, and I'll be taking some notes as questions come up as well. So maybe in the future we can have additional fireside chats to follow up on any questions or issues that might arise from this. So thank you, and thank the presenters as well.
Thanks very much for that introduction. It's Laura here, and the format of the presentation that we're going to give will be that I'm going to introduce some of the macro questions first, give some of the models and concepts and some overview pieces about where we are in terms of legal services for seniors in Canada. I'm so pleased to be joined with Judith Wall, who will be able to provide you with a really rich understanding of her more than 25 years of experience running the Advocacy Center for the Elderly. So the two of us will go back to back, and we have lots of time for active discussion. So I'm going to encourage you to be thinking about questions, jotting them down, etc. We're going to have, as I say, a good amount of time for active discussion. So this is a great opportunity for us all to talk to each other and learn a bit more about what's happening in Canada, or what's happening in terms of thoughts that you may be having about this issue. So just to give you some of the details first, I've got a couple of slides with our contact information. And again, you have all this contact information on your PowerPoint slide that has come out to you individually as well. But I'm located out here in Vancouver, and Judith, is located right downtown in Toronto. Having said that, my services look across the country, and I run a National Center of Excellence, which means I do essentially research and law reform and outreach relating to those issues. Judith will give a fuller description of her services, but I wanted to say that the Advocacy Center for the Elderly, while it is in Toronto, has a much broader focus, and I know that she'll pick up on that piece in a moment. Let me take just a brief moment talking about what the issues are as I see them and where that's led us in our thinking. The National Center that I run looks at issues on a broad base. We look at systemic issues, we try to support capacity building, and we do law reform pieces related to issues that we hear up from grassroots organizations, in from government, out from health services, in from police, etc. So we work on a very multidisciplinary, very collaborative approach. So we try not to sit in any ivory tower, and those of you who know, we try to get out as much as possible. And that really has focused in the last 5 years around the need to support capacity building for legal services. And I can say that the landscape is quite barren in this country for those types of services on a low income or pro bono or financially really very accessible basis. Many of you will know that legal issues, while they can be adjudicated in the court system, have enormous access barriers for older adults, some of which is just purely financial. It's just very expensive to go to court. Some of which is an access barrier that they may not understand the system, or they may have physical barriers or mental capacity barriers. There may be other diversity issues that we'll speak about in just a moment. But what we have heard in our analyses in the last 5 years of looking at these issues is for older adults, the idea of going to court can be repugnant. It can be not what they want to do. It can be exactly what they want to do, but they can't get there because they don't have the services available, or they don't even know what the options are because there's nobody to help them. And so I'm going to talk a little bit about some models that we are looking at in Canada and around the world that have been considered. And I'm going to stress that the Canadian context is very important. So I'm going to talk a little bit about some models in other jurisdictions. I'm going to emphasize that regionality is extremely important and that most of the laws that affect older adults are actually provincial or territorial in nature. So we have to know that the issues that we're having, while they may be the broad-based issues across the country, how they're dealt with tends to be done by individual province or territory. So the learnings are not always exactly right, and the models are not always exactly transferable. So there's my caveat there. I know that you know that we are having the largest demographic shift in history, and you probably also know that well-known saw that in about 2041, about a quarter of Canadians will be over the age of 65. And in some areas, that will happen much earlier. In British Columbia, for instance, which is an intermigratory province, that's likely to happen about 10 years before that. We also know that in Canada, there are really inadequate services for seniors. And in some provinces, this may be more dire based on also provincial policies or territorial policies. So in the experience, for instance, just of British Columbia, to take one province, for example, we know that services to seniors are being routinely cut. And services, whether that means home support services, services in terms of getting health, welfare, personal care support, but also services in terms of community programs, etc. So in the context of that, we also have layered on continued stress to our public legal aid systems. In some jurisdictions, it's much more robust, and I look to Ontario and Nova Scotia, et cetera, for their, I think, better and more integrated legal aid clinics. In other jurisdictions, and I'll use British Columbia as an example, we have almost eviscerated our legal aid system. There's almost nothing left. So the context, in my view, is a reduction of services generally to seniors, a reduction of legal aid services generally to everyone, and the largest demographic shift in history. And to me, that creates a perfect storm of issues. So what I'm hoping comes out of this particular webinar is sparking some ideas about how to address how these things come together.